All right, so there are those who work in medicine, and then there are those who move it forward. My guest today is one of those rare few. Dr. Duna Raoof is a board-certified, fellowship-trained ophthalmic surgeon with Envision Eye Centers right here in Orange County. She's Harvard-trained, Michigan-raised, and relentlessly curious. She's one of the first surgeons in the U.S. to implant the Clarion PanOptix trifocal lens, and she's been leading the way ever since. Mastering advanced cataract, LASIK, EVO ICL, SMILE, and light-adjustable lens technologies that are transforming what's possible for patients. But beyond all that, she's a leader, she's a mother, she's a communicator, and a surgeon who brings heart into a field built on precision. Duna, I am so fired up for this conversation. Welcome to Eyes Wide, the podcast.
Thank you, Craig. I am so fired to be here tonight as well. And thank you so much for that generous introduction.
Yeah, you earned it. So we were talking a little bit earlier, and were you actually born in Scotland?
I was, yeah, kind of a random place. But my parents are originally from Iraq.
Okay.
And they're both physicians, and they were classmates in medical school. And when they finished medical school, my dad got a scholarship to go get a PhD in Scotland. So that's how I ended up being born there. And then eventually we made our way to Michigan.
And you're a Wolverine, right?
I am 100%. I say I bleed maize and blue.
Yeah, that's good. So I'm a Penn Stater, and
Okay.
in other years, I'd like to say that we had a good rivalry, but I don't know.
Yeah.
This year has been tough.
It has not been good
for both of our squads. And I think you're still doing better than Penn State is doing right now.
Slightly, yeah. But yeah, all my siblings went to Michigan. I was a Michigan lifer before leaving the University of Michigan.
Got it. Excellent. So I will say that upon my coming to Envision Eye Centers, I believe you were the first person that I had an opportunity to listen to speak about some of the services, the offerings that Envision has for patients. And I instantly took note because I felt like, and this has continued with other talks I've heard you and I hear you with patients, and that you always have this very calm confidence that instantly puts patients at ease or listeners at ease, optometrists at ease. But I've got to ask, I mean, were you always drawn to the precision side of medicine, or kind of did ophthalmology find you along the way?
What really drew me to medicine initially was science. I loved science, and in high school, I just loved biology and loved learning about the human body. That told me from a very young age that I wanted to go into medicine, but I didn't really discover ophthalmology until I was in medical school. I shadowed an ophthalmologist my very first month of medical school. He was doing cataract surgery at the University of Michigan, and I watched about 20 cataract surgeries that day, and I just fell in love. It's exactly that you mentioned, the precision, the elegance, the delicate microscopic procedure that is not just infinitely complex, but also simple, that just made me fall in love with ophthalmology, and it was one of the best decisions of my life.
You know, a lot of people, a lot of doctors specifically, and this applies to basically as a question for doctors, is that a lot of doctors can kind of trace back to that one moment in time or the one patient. You mentioned that you started to get some familiarity and you're working towards this, but was there one patient experience that kind of sets you forward along this journey? You're just like, yeah, this is what I'm going to do for the rest of my life.
You're very accurate in that there usually is a moment. And for me, it didn't come until a little bit later on when I was actually doing my ophthalmology rotation. I knew that I loved doing surgery, and I loved making an impact with my hands. And that was what drew me initially to ophthalmology. And during my ophthalmology rotation in medical school, there was this one patient in particular. It was during my rotation at the VA hospital in Ann Arbor. And this guy had an extremely dense cataract. He has not seen in years and had limited access to care. He lived several hours away from Ann Arbor. And finally, it was his time to have cataract surgery. And it wasn't the day of his surgery that made the big impact on me. It was the next morning when he came in for his 1 day post-op visit, and we took the patch off. And I still have goosebumps thinking about that moment
I
when
can tell.
this guy was in tears. He can finally see, or people around him. He was finally able to see his wife. And that moment, just having the ability to contribute to that moment is what solidified the decision for me that this is what I want to do for the rest of my life.
I love that. Uh, Conversely, what was the toughest part of that journey?
Ophthalmology is very competitive. And it's one of the most difficult specialties in medicine to get into. And I think part of the reason for that is because it is such a wonderful specialty that really combines surgery, clinical medicine, direct patient care, and getting to attain that goal of not just an ophthalmology residency and an ophthalmology fellowship, but also striving to be in the best programs in the country. It was really hard. I spent my 20s studying and taking care of patients in training. And I've had some years, like in my fellowship, where I was working easy 80 hours a week.
Mhm.
Those were tough days, but the commitment and
Yeah.
the goal at the end of the road
Mhm.
is what made me stay in it and keep fighting.
It helped you push
And
through. It helped you push through it.
right.
So, I've had a lot of experience working with cardiologists who came from Harvard Cardiology, and it is an elite group. As a matter of fact, I used to work with a group up in Santa Monica that in their practice, they only allowed people that went to
Hmm.
Harvard Medical School
Hmm.
to be able to be in this practice. So it's obviously an elite group. I would imagine that getting into Harvard for ophthalmology is no easy task. And I can't even imagine, A, what that's like just to meet the criteria to be able to get into a program of that caliber. I'm sure it was tough to battle through. You mentioned the light at the end of the tunnel, but how long is that road? And was there ever a time where you were like, you know what? Maybe, as much as I love it, maybe there's something else.
After high school, obviously, you do the 4 years of college, the 4 years of medical school, 1 year of combined general surgery and internal medicine. That's the intern year, followed by 3 years of ophthalmology training, and that's very intense hands-on training, followed by your choice of 1 or 2 years of fellowship, and I, of course, chose two. So it's a total of 6 years past medical school.
Okay. Excellent. Excellent. So let's get into some of the fun stuff. So you light at the end of the tunnel, you get through it. And obviously you seem to me, now I obviously I have a first class ticket into being able to watch you in this aspect of the business, in this aspect of you being an eye surgeon, but the fun stuff, the innovation. How did you start to get established as an innovator, someone that wanted to be at the forefront of new technologies and to enter into forays that maybe not a lot of others have gone to yet, but you want to establish yourself as one of the premier individuals doing these different innovative procedures?
As somebody who has always loved science, and that was my route into going into medicine. Even though, yes, the surgeries are rewarding, and what really drives me is that impact I have on patients. But every innovation I adopt, whether it's an advanced intraocular lens implant or a new glaucoma surgery or a new type of corneal transplant, that is what really drives my love for this field, and my passion for continuing to do more and more for my patients. Medicine is continuously changing. And one of the things I love about ophthalmology is how intertwined it is in technology. There is always something new that is being investigated or is in a clinical trial or is new on the market. And I want the best for my patients. I want to be able to deliver what is the best and what is hot off the press that I know will deliver excellent vision for them or preserve their vision. So that's what drives me to continue to looking for new technology and adopting that in my practice every single day.
It's 2025, and I feel like patients are smarter, they're savvier, they're doing a
Mhm.
lot of research on their own. Also, they're doing a lot of research with the surgeons they're seeing. We're in Orange County.
Yeah.
There's a lot of great surgeons in Orange County, San Diego, up to Los Angeles. How do you start to differentiate? How do you start to differentiate yourself in the marketplace? How do you stand out from a very qualified field?
Several things come to mind. The field is definitely, I wouldn't say saturated. There's, in general, nationwide, a shortage of ophthalmologists. But just being in Orange County, there are several ophthalmologists that are in several similar specialties in this county. And I think what really sets me apart is my compassion and my personality when it comes to taking care of patients. It's happens very often that I am the second, third, or even fourth opinion that a patient is coming to see. They are well researched, well educated. They're meeting with different surgeons, learning about the different technologies that the different surgeons are doing before choosing one. And there are a lot of great surgeons out there, but not everyone delivers that human touch, or going that extra step, that allows the patient to feel confident and give them trust. And we're talking about vision, we're talking about patients' eyes. I just had a patient text my coordinator yesterday. I was doing cataract surgery, and he actually came to me as a second opinion, and he was extremely nervous about the surgery. He knew he needed cataract surgery for a long
Mhm.
time, but was just so nervous. And that text message, he sent it to my coordinator as he was leaving his house to head to the surgery center, saying, I am more terrified than I was when I was heading to my triple bypass surgery.
Wow.
And because I use my eyes every day. Granted, I know he uses his heart every day as well, but
But it's not the same thing.
it's really scary. And it's very common that when I'm about to take a patient back to the OR, when I go say hello to them and confirm everything in the pre-op area, they tell me I'm really nervous. And I tell them that's completely normal. Everybody that walks in through this door is at least a little bit nervous. It's your vision, it's your eyes. I promise you I will do my best. And I see immediate calm just come over their faces
Mhm.
and their demeanor, and I think that's a big differentiator. Another thing that's really important too is follow up and follow through with patients, not just doing the surgery, because not every patient has the same journey. Some have ups and downs, some have slower healing, and rarely complications can happen. And what I was taught from a very young point in my career is that what makes the difference between a good surgeon and an average surgeon is how you manage the tough cases afterwards, or how you manage complications. My patients that have a difficult healing time or a difficult journey afterwards, those are the patients that have my cell phone number, and they can call me or text me anytime. And I think that's rare to find these days, but I like to make sure that my patients know that I'm always there for them.
So I love that. And you just hit on so many different things. I'm going to try to kind of touch on each of them and unpack each of them if we can. But first off, I'm going to let you in on a little secret. And for the listeners, I was brought into Envision to launch. You mentioned earlier about a glaucoma procedure or
Mhm.
what we call minimally invasive glaucoma surgeries. And the iDose is something that I was brought in to really get going at our clinics. And the secret is, I mentioned that you're one of the first people I heard speak about it. And I also had the opportunity to listen to you then speak to patients about it. And I used then, and I still use an awful lot of what I learned from you when speaking to
Oh.
patients, when speaking to optometrists. You mentioned compassion, and it's so obvious. And it's like I've got goosebumps now just listening to you talk about compassion because I recently went through something. I ruptured my biceps tendon, and that's my arm. I mean, I got another one, right? But still, I was so scared going into surgery, and I would keep asking all the staff their questions. And then when the surgeon showed up, and I remembered like he could tell I was nervous. And, I like to pretend like I'm a big tough guy, but the situations when I'm definitely nervous and scared. And I remember he just put his arm on me. He just put his hand on me.
Mm.
And he's just told me, he's like, I got you. I'm going to take good care of you. And it was fantastic. And in this age of artificial intelligence, let's remember at the root of what AI is, it's artificial intelligence. As human beings, as much as we like data and we like information, cold hard math, we still have a need for that touch,
Mhm.
for that connection, for that warmth. So when it's all said and done, those that are able to differentiate in the way of conveying that compassion and not just being a check the box approach to medicine, whether it's their heart, their eyes, their arm, their leg, it doesn't matter. There are going to be those few individuals that will truly make an impact. Like when you think back to who your favorite teachers were, it's the same experience for these
Mhm.
patients. And the sad part of this is it's nothing that we do, elective or non-elective, nothing is 100%
Mhm.
risk-free, right? Everything we do in life, not just medical procedures, there is inherent risk to. And we're going to get into that in a little bit later on in this conversation. But I wanted to just let you know that how fond I am of your approach to this innovation. And yes, I continue to steal an awful lot from you. So thank you.
Thank
And we've
you.
been able to really get that iDose initiative going for our surgeons to be able to offer to our patients. And then you and I both did a spot for Glaukos a few months ago, talking about not only what this means for patients and being able to provide this to more and more patients, but what it's like to truly implement this into the daily repertoire. Because any type of doctor, especially uh, in when it comes to eye care, there's so many patients in need. You mentioned that yes, we are in Orange County. There are a lot of eye care providers. There are a lot of great surgeons, but there's a lot of patients in need.
Mhm.
And so being able to take the time to think through the opportunity to be able to offer some of these new innovative approaches to medicine, that takes a special someone, and you see it. And so on behalf of the patients, I know that they thank you for taking the time to learn about some of these new technologies, be able to understand them enough to convey them in simple terms, in appreciable terms to the patient, and making them not be scared, to be open to the idea and hopeful that this new innovation is going to be something that changes their life.
I love how you put that. And you're right. Even though they have so much access to resources and artificial intelligence and PubMed and everything online that's out there, at the end of the day, they come to us for our expertise. And even if they have looked up every type of intraocular lens implant or every glaucoma procedure or eye drop, they come to us because we have that experience and skill to guide them and to make their decision. And that trust is huge. And it means a lot to me. And continuing to advance and push the field forward and offer what's best for them allows me to serve those patients.
I love that. Uh, Clearly, just in your description of taking us through your experience from the early years, and then not, I won't say struggles, but obviously it's work to get to
Yeah.
where you are. I don't think it's any stretch of the imagination to say that you are a very driven person, and driven people need to be on and on and on all the time. How do you turn it off?
Do I turn it off? um, well, I my I'm a surgeon, like like we've been talking about, but I really consider my number one role in life now is a mom. I have three amazing kids, and honestly, they're my motivation. And when I'm with them, yes, I'm away from work, technically turned off, but I am on 100% full time mom mode. But watching them, watching their curiosity, their resilience, reminds me of why I do what I do, and they help me keep perspective to stay grounded in what really matters.
Do they think you're a superhero?
I don't know. I actually taught the eye science class for my first graders classroom last week, and she was so proud. She was asking all sorts of questions and raising her hand, and I was telling the kids all about cataract surgery and LASIK and vision, and she was just beaming. She was so excited I was there.
I love that. I'm going to ask something a little bit more provocative if I can.
Go ahead.
Being a strong, capable, extraordinarily capable woman ophthalmologist, is that an advantage or a disadvantage in 2025?
I would say it's a little bit of both.
Okay. Oh, gosh, I was hoping you
Yeah.
would answer it that way. Now I'm really interested.
Yeah. Uh, so yes, we're in 2025, and you would be surprised how sometimes there are people that have kind of an older generation mentality. And I think being a woman in medicine and in a surgical field has always made me try to become better and better because I feel like I always have to prove myself. That was definitely the case when I was in medical school and as an intern. When, I felt definite times of preference or differentiation, whether it's from staff members or from patients, to have a male doctor or a male surgeon. On the other hand, I have been blessed with countless patients that come to me because I am a woman. I actually had one patient recently who said, I came to you because you have really small hands and I think you're going to be really good at microscopic surgery, which was really funny. But I do think that. Ultimately, it's your skill and your training that makes you who you are, regardless of your gender. But given my background and being a woman and being a mom, I feel like I do offer, it's helped me develop kind of my empathy
Mm-hmm.
and communication. I think communication is so important, especially as a surgeon. And it's almost like a joke that surgeons are typically not good communicators, but I try
Yeah.
to be a really good communicator with my patients because I want them to understand everything that they're going through and what to expect from their surgery. And I think, that's kind of the human aspect that I bring into the table.
So I don't know if you're going to believe me when I tell you this. First off, thank you very much for sharing that. But I literally was going to ask you about the importance of communication. And as we talk about innovation and we talk about being able to, I don't want to use the word convince because I don't want to give the wrong connotation here, but um, physicians, especially innovators, are in the business of offering new hope
Mhm.
to their patients. And as new procedures come out, new therapies, new products, there's a little bit of sales that goes into it. And obviously, sales is something that's near and dear to my heart. And a lot of times sales gets this bad rap.
Mhm.
And it's like, oh, you're a salesperson or you're too salesy. And I'm like, yo, if you don't think that you're selling every aspect of every minute of your life, you are dead red wrong. Sales is all about the ability to convey what's inside of here and inside of here to the person listening and make sure that they can see exactly what you see and they can feel exactly what you feel. If you can accomplish that, you can quote unquote sell a person, right? And so I've been so fortunate to be a part of a few different rather big launches in different spaces in the cardiology world, now in vision. And it's funny because for some reason, like I said, sales gets this bad connotation. But I've been in rooms, and especially early on in some of the more advanced cardiology procedures that were going on. I won't go too in depth, but it had this thing called cardiac resynchronization therapy that came out, and then cardiac ablations was becoming all the rage. And then the latest endeavor I had, there was a new device in heart failure where you were stimulating the carotid to affect the mind, to affect
Mhm.
the central nervous system. And so it took a lot of understanding, but then it took a lot of the ability to be able to convey that impactfully to a patient. Because when something's new, because when they don't have all this access to all of the information, they're relying on the doctor. They're relying on the person they're speaking to. And they're, even if their words aren't coming out of their mouth, they're asking you, is this what's best for me? The way I am, the disease state that I currently have, how I present as a patient, is what you're talking about the best thing for me right now? And the sad truth is, so many patients have missed out on game changers along the way, all because the doctor, and this is the sad truth, the doctor couldn't sell it properly to the patient, couldn't hit on all the sensors to that patient that they needed to in order to get the patient's interest, to make them understand what that doctor understood. And that is really saddening because a lot of people lose access to really great
Yeah.
opportunities.
The way that I practice medicine, there's no sales involved. It's listening to what your patient wants, and myself as the doctor clinically evaluating what the patient needs and putting those together and giving the patient my recommendation and their options. And as a uh, the physician, I think it's my responsibility and it's my obligation to clearly and effectively give the patient those options and fully explain the pros and cons of each option so that they can make the best educated decision for themselves. To me, that may come off to some people as salesy, but it really isn't. When I walk into a patient's room, say who's there for a cataract evaluation,
Hmm.
which is something that has multiple levels of price points. There are different lens implants, different ways that the surgery can be performed, and there are different costs to each one of these things. When I walk into that patient's room, the first thing that I do is I listen. I ask them a couple of pointed questions. What's your lifestyle like? What are your hobbies? What are your activities? What do you do for work? And do you drive a lot at night? What is your desire as far as your dependence on glasses after the surgery? So, the first step for me is just listening to their wants
Hmm.
and their needs. The next step is I examine them, and by looking at their eye and doing a full comprehensive clinical evaluation, in my mind, I am deciding what lenses are good options for this
Hmm.
patient and what lenses should be ruled out for this patient. And then I present to them the options that are out there. And based on what you told me, based on what you want, this is the lens that I recommend.
Got
This
it.
is going to accomplish what you wanted, and you will be happy with this goal. If you do this other lens, you'll still see better than you see right now, but it's not going to accomplish this goal that you told me you wanted. And this one does cost less. So I just basically go through that algorithm with every single patient, and they really, really appreciate that. And my quote unquote conversion rate or success rate of getting the patient to book what I recommended is extremely high.
Hmm.
So someone might say, oh, you're a good salesperson, but I don't think of it as sales. I think of it as my duty to explain to them what their best option is
Hmm.
and let them make that decision.
So I'd love to continue down this path, get into some of the details around what you do. Um, People listening to this are going to be all different ages. And I want to talk about LASIK, but not right yet. I want to get to LASIK in a second. But you mentioned cataracts and also this idea of RLEs,
Mhm.
because there's this time that exists, patients that wanted corrective procedures done in their late teens, maybe early 20s, getting into their 30s. And as you transition, you're not ready for a cataract yet, but you're not the best candidate for LASIK. And so the RLE patients, what we like to call CLR at Envision, is virtually the same lenses. And so there's a lot of different options in there. But is what you're telling me that the most expensive and the best, if you will, isn't the best for everyone? Like, can't you say
Exactly.
I want the best?
Exactly. I've had patients that come in and say, I want the Maserati of the lenses.
Yeah.
And I'm like, okay, well, what's Maserati for you may not be the Maserati for another person. It all depends on your eye geometry, your pre-existing prescription, your natural lens status, and what your visual needs are. And based on that, we will come up with what is the Maserati for you. And that's why when I have a patient that comes in for a cataract evaluation, they undergo about an hour and a half of just testing. I tell them it's the most comprehensive eye exam you will ever have. We do every test from the front of the eye to the back part of the eye.
Hmm.
I look at their corneal topography, their aberrometry, their retina status, their optic nerve. We're evaluating them for potential early signs of macular degeneration or glaucoma,
Hmm.
things that may impact their happiness with this lens choice in 10 or 20 years, because this lens is going to be in their eye for the rest of their life. And based on that, I can confidently tell them that this is the best lens for you, whichever one I end up deciding is the best one for their eye health. So everyone is different.
Okay. So I want to talk about that one patient. Maybe it's more than one patient, but there has to be a time when you emphatically uh, work to talk a patient out of a choice that they were making because they wanted the Maserati, and you were telling
Mhm.
them this isn't the best option for you. And they said, yo, doc, I want the Maserati. So you gave them the Maserati, and then they complained.
That happens. Unfortunately, that happens sometimes.
How do you handle
Um,
something like that?
well, I initially stand firm with, my recommendation, but if a patient has done their research and this is what they choose to do, I tell them I'm happy to do it as long as you understand the risks and benefits of that option, and as long as you are prepared for the disadvantages that may happen from this, and as long as they know that and they understand that, and I have a very frank conversation with them about that. And, you know, I'll pick up the phone and I'll talk to them for a good 30 minutes. I just did that yesterday during my lunch break. I was talking to a patient who was that same exact scenario.
Mhm.
And he was actually the opposite. He wanted to go for just take out my cataract and put the cheapest
Yeah.
whatever lens in. That's what I want. But I also want to see perfectly far away.
Yeah.
I want to see the golf ball 100 yards away.
It doesn't
And
work that
I
way.
want to be able to look at my phone when I wake up in the morning.
Mhm.
And so I called him and I was like, I will not be able to deliver that with your current choice. And cost was not an option for him. He was
Mhm.
just, or was not an issue. He just wanted, he was a very busy executive and he didn't want to deal with all the extras that come with the more
Yeah.
advanced lens implants. He was like, just replace it. But I was like, you're not going to get the outcome that you want. And then at the end, he was like, Dr. Raouf, just tell me, am I being ridiculous? Should I just go with what you're recommending?
Yes.
And I said, yes, I am confident you are going to be happy if we go with the option that I recommended. And we're going to go with that. So I haven't done his surgery yet, but I am confident he's going to be so
Nice.
happy with what we picked for him.
I mean that is the conveying of belief that I talked
Yeah.
about. And it's for whatever reason, not that you didn't do it properly to begin with, but for whatever reason, his eyes weren't open, his ears weren't willing to listen at that
Yeah.
point, and so he couldn't understand how like confident and how much you believe that this was the best option for him with his condition. And so finally he was able to understand. So
Yeah.
let's talk about, I know you're someone that is on social media. I follow you. You have some great posts. I love them.
Thank you.
And let's talk about social media right now for eye doctors. What is that like? What's that world like? Is everyone doing it? Are some doing it? Do you have to do it? Do you want to do it?
I would say some are doing it. It's still not really a mainstream component of everybody's practice, but more and more people are doing it, and it's encouraging others to get involved. Like we talked about earlier during our conversation, is what sets me apart. Social media to me is a tool that I can utilize to show my patients what sets me apart. And I love it because it's direct, it's in their hands, it's
Mhm.
free, and I can be transparent and honest and directly talk to patients and tell them about certain procedures that I do, certain technologies I'm excited about, and have them hear me directly. So I think it's great. I would love to do it more. I would love for more doctors to do it. I think it's a fantastic toolbox in our use now that we should utilize.
It is time consuming. There is no
Oh,
ifs, ands, or
yeah.
buts about it.
That's the worst thing about it. It takes up a lot of time, and to put a nice, well-executed post, I do wanna make sure that I spend a lot of time on it. Anything that is out under my name, I like to make sure that it's perfect and,
Hmm.
is truly reflecting what I wanted to say, and that takes time, and when I'm juggling multiple hats and seeing lots of patients and operating all day, kind of at the end of the day, that's a hard thing to sit down and do.
Yeah, and some of the stuff I've seen, you definitely went hard in the paint with the editing. I was like, wow, she's really going after it. It's good.
I like to make sure it looks good. I've seen others that have much more output
Hmm.
and post a lot more frequently, but maybe don't spend as much time on each post. That's a totally different strategy, and I still don't
Yeah,
know what's best.
there are multiple
Um,
strategies.
yeah,
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 yeah. We can shout out some of the guys from Envision, like Katzman, Pernazar, R Rider. They're
I
doing
love
some
them.
funny. They're doing some
Yeah,
funny stuff, and
yeah.
tip of the cap to them because they're doing things that I don't know if I'd be able to pull off.
I
And
agree, yeah.
Yeah.
I've been very impressed with their work. They're doing a great job.
So the strategy, um, speaking events and being on stage, being
Mhm.
able to give presentations, I would imagine present papers and whatnot. This is something that I believe that you have a love for and want to do more and more. Are you using your social media to help on that front as well? And has it been helpful?
Absolutely. I love to connect not just with patients, but with colleagues and with the community. And I also love to teach. And social media has definitely allowed me to do that. I've always had a passion for teaching. I actually, in the beginning of my medical training, I thought I was going to go into academics and
Hmm.
I wanted to become a professor one day. I even dabbled into the idea of, going and getting a PhD after medical school to
Of
become a
course you did.
professor and to teach. And so to satisfy that part of me, my first few years in practice, I was faculty at UCLA teaching the UCLA ophthalmology residents how to do cataract surgery. So I was, the attending in the operating room, and that was so satisfying. And just recently, I connected with one of the students that I taught on social media. He was following me, and he's now a practicing ophthalmologist elsewhere in the country. So it's just kind of a full circle of how, social media and teaching were
Yeah, it
connected
brings
for
it all
me.
together.
And even now, I have, optometry students, cornea fellows from Loma Linda, sometimes medical students, undergrads that come to the office to shadow me. And that allows me that direct human
Hmm.
connection as well to teach and to pass on my skills in a different way from social media. Social media is great, and you're able to touch more people's lives, but I don't think it by any means replaces or is equivalent to that human connection
Hmm.
that I truly enjoy. So I try to make sure that I still teach face to face.
Got it. So we're on the social media topic. TikTok is obviously a thing, and a lot of the guys I mentioned they're pretty active in the TikTok world. You ready to talk about LASIK?
Let's do it.
Let's talk about LASIK. Is LASIK done?
No, absolutely not.
Okay.
LASIK is one of those procedures that, for some reason, goes ups and downs. Um, we have seen historically that there are some dips in patient interest, and then it goes back up. We just had a surge of LASIK during and immediately post COVID.
Hmm.
I think that LASIK is one of those um, immediate satisfaction, incredibly big impact procedures
Yeah.
that is really one of the most precise procedures that exists in all of medicine, not just ophthalmology. The way that we can correct a quarter of a diopter of nearsightedness or astigmatism is just absolutely incredible. And no other procedure matches that. There is a need for LASIK, and I think it's going to pick up at some point and it's
Hmm.
going to grow. And our job is to continue educating and continue spreading the word.
So it's obviously it's getting a little bit of a bad rap right now. There's a lot of negative press on LASIK, and I started watching one of those recent movies that came out, and I was trying to get a feel for where they're coming from. And anytime you watch a documentary like that, it's obviously keyed in and focused on the negative outcomes.
Mhm.
And so after I watched the pieces I did watch, the curiosity, speaking of curiosity, I started getting real curious of where this ranks, like where the LASIK procedure. You mentioned it, you just nailed it. One of the safest procedures in all of medical
Mhm.
elective, non-elective procedures. And I started like really digging in, and I had some stats here. And so they looked at some different procedures out there. These are basically all elective procedures. You got your rhinoplasty, your liposuction, Botox, breast augmentation, and LASIK. And you already know this answer, but some of the listeners may not know that LASIK is ahead of each of these procedures, but I don't think they know by how much LASIK is ahead of all these procedures. Now, granted, I don't have this sourced. Speaking of academia, so I can't cite the paper, the white paper this came from, but the data that I was looking at, LASIK was less than a 1% complication rate, I think, is what is brought into the marketplace. And you know what's interesting about that, when you talk about the safety of LASIK, what it truly means to have a 1% complication rate. Dr. Tuma is basically, for all intents and purposes, the godfather, if you will, of LASIK, especially in Southern California. And how many procedures himself has? Over 400,000 LASIK procedures, right?
Right. Yeah.
And 1% complications. And this isn't something that's performed, here and there. And your average MD doing the procedure does 100 or 200 or 300 of these. This is a large sum of procedures being done. There are going to be complications, but you compare it to breast augmentation. Breast augmentation like 95% complication-free rate. Botox, some of the Botox, is an injection between 85 and 90%. Liposuction, there's so many horror stories on going to get that procedure, but people don't talk about it as much. 80 to 85% event-free with liposuction, and rhinoplasty. Whew, that's a tough one.
That's a bad one. Yeah.
You're rolling the dice with that one. You're looking at, like, you're scratching 70%, like 3 out of 10 can go bad. That's one that you start to say, okay, do I really want to have this one done? But the kids, the Gen Zers, right? They're not into this idea of vision correction right now. Glasses are cool. Like, is that a thing?
I think that's what it is. I think glasses are cool, and a few very loud opinions that are anti-LASIK have kind of infiltrated through the social media, Instagram, TikTok, and they're all about that. When something like this goes viral, our younger generation, the Gen Zers, that's what they're listening to. Just see how fast any trend takes off, even if it's a ridiculous trend. It just takes off like crazy, even if it's completely baseless. And I think that's what's going on right now. But like I told you, Craig, I really believe it's going to change and it's going to turn around. In the generation after that, who are the little kids, I'm talking, ages 5 to 16, 17 right now. These are the kids that are not eligible for LASIK yet because they're too young. We don't do LASIK on kids that young. But that's the generation that is constantly on screens right now. They all have iPads and iPhones. My third grader is doing her homework on her laptop every night, which
mine too.
My generation didn't. So all these kids, unfortunately, they're developing myopia or nearsightedness. We are witnessing an epidemic of myopia that's happening because we are on screens all the time. It induces more nearsightedness when you are doing it as a kid. Multiple studies have shown that sunlight reduces the development of nearsightedness as a child, and kids are spending less and less time outdoors and more time on their screens. What I'm trying to say, the point I'm getting at here, is that generation is all going to be in glasses and contact lenses because of this myopia epidemic. And I am confident there's going to be a surge of people wanting to get LASIK at that point. So it's going to go up and down. Right now we're in a downturn, but I'm confident it's going to go up.
So I've got to ask, when it comes to their eyes, do your kids listen to you?
I am actually very strict about screens. And yes, they do. We actually don't allow any screen time other than what's for homework.
Okay.
So my third grader gets on her laptop to do her homework, but otherwise, we don't do any screens, no iPads, no phones, uh, no TV. They watch a movie every once in a while, but that's about it. I'm a big believer in keeping them busy in good things to stay out of trouble. They're all in sports and they're outside doing their sports all day.
I mean, you heard it here. You've got one of the premier eye surgeons in Orange County, California, giving you some advice on where screen time should be for your kids. And
Yeah.
I will not be able to convey back to you the limits that I put on my children for their screen time because I will pale in comparison. But I will tell you, when they get older, it is an extraordinary
Yeah.
tete-a-tete with
Yeah.
regard to the screens. It is like nothing I've ever seen. The only thing I can equate it to, is if you've ever been around a dog or if you have a
Mhm.
dog
Mhm.
that gets like food aggressive, or
Yeah.
you go to take away food from a dog.
Yeah.
It is insane what happens to these kids, and it's not just the eyes. Is obviously it's everything they get from the screen. Whether you're
The
talking
sensory
dopamine, yeah, the
overload.
sensory overload.
Yeah.
Um, but we're not even talking about the detriment and the devastation it's
Yeah.
doing to their eyes. I mean, you can't get away from it. Last thing I want to ask you about is obviously we talked about you being an innovator and you've got your finger on the pulse. Where do you see ophthalmology 5, 10 years from now?
That's a great question. I'm looking at ophthalmology 5 years ago, 10 years ago, and how much it has changed in the last decade. The way that we do cataract surgery, the way we treat glaucoma, the way we do refractive surgery, it's evolved tremendously in the last 10 years. So I can only imagine where it's going. I think that for cataract surgery, we are going to continue to see this amazing outflow of lens implants that give patients more precision, better clarity, and a wider range of vision with less undesirable side effects like halos or glare. I already see that happening. We already have incredible technology, but I'm so excited to see what the next 5 to 10 years will bring. It's only going to get better. The field of glaucoma is totally different now than what it was when I was in training. It's pretty remarkable. We really only did eye drops,
Mm,
and the glaucose eye stent was a new thing that only a few surgeons were doing when I was back in training. And now it's the standard of care.
mhm,
Glaucoma was traditionally thought of as eye drops all day to slow down the progression of blindness. It now is becoming dropless, and we're protecting the optic nerve better. And with iDose and iStent and other procedural glaucoma procedures, I think we're finally going to have uh, better control of this horrible disease. For refractive surgery, as I mentioned to you earlier, Craig, I am confident it is going to blossom, it's going to grow. Not just LASIK, but also clear.
mhm.
We touched on CLR, which is a clear lens replacement. I think that procedure is going to grow exponentially in the next 5 years. Patients are learning about it. Surgeons are becoming more confident in offering it and educating patients about what it is. And just for our listeners here, this is a procedure that allows people in their late 40s or even early 50s to gain independence from their glasses. Presbyopia is the condition where you lose your close-up vision starting your
Mm.
40s, and it's horrible. It's you lose your ability to see your numbers on the watch or look at your phone, and to finally be able to do that and know that that's a fix for the rest of your life and it's not going to change is truly incredible. So I foresee that lens replacement is going to really take off in the next 5 years.
That's impactful. And I fully agree. A lot of the work that we're doing at Envision right now is around or in that space. It is truly the next frontier of opportunity for improved vision, improved eye care. And so I love it. And obviously, I love that you're going to be at the forefront of it. And I can't wait to just see what you do with it, leading that charge. With that and the advent of new technologies, we mentioned you doing speaking, and I too like to give a few speeches every now and again, a few talks. What's your secret for getting ready before you go up on stage?
Know your material very well and connect with your audience. I think if you know your material really well and you have clarity of what message you're trying to deliver, and you communicate well and connect well with your audience, that will allow you to deliver an excellent speech. Um, I I'm sure that a lot of people will go on stage thinking that they know their material well, but once you're up there, you realize there are some holes, and it's kind of like a Swiss cheese that some gaps in the knowledge. So you really have to know what you're presenting and be confident of all the information that you're going to present, and be able to connect with people in the room and educate them on what you have to say.
I love that, and you're speaking my language through and through. I talk to people about this idea that if they don't know their material inside and out, it'd be
Mhm.
like a bad actor not knowing their lines, and then just delivering lines like blank words that are on a page and doesn't have any feel, doesn't have any meaning. If you're just in your head thinking about what you want to say, you can't convey that passion, that enthusiasm, everything that we talked about, your belief. So that resonates so much with me, and I hope it resonates. I know it resonates with the listeners of this podcast.
I agree. I love that you brought up enthusiasm too, because th- that's up there too, top three of what things that allow somebody to be a good speaker. You have to be excited about what you're talking about. And if you're not, the audience will see right through that.
I love it. Did we miss anything? What do you think?
I think we covered a lot.
Can you
I think
believe an
that was
hour went
great.
by already?
Oh, wow. 7:40. That's
Like that.
great. I love it.
Why don't you tell people where they can find you?
My practice is divided between two offices in Orange County. I spend about half of my time in our Newport Beach office and the other half in our Laguna Hills office. I perform my refractive surgeries like LASIK and SMILE in Newport, and I perform our lens replacements and cataract surgeries in Laguna Hills. You can find me at our Envision website. You can also find me on Instagram at Raouf Eye.
Excellent. Beautiful. I'm going to go ahead and wrap this up. Did you save anything for our second session?
Oh, well, we'll have to come up with some more stuff.
Excellent.
Yeah.
Excellent. What I love about conversations like this is that they remind us that excellence isn't just about mastery. It's about movement. Dr. Duna Raoof represents everything that's right about modern medicine: precision, compassion, and the courage to keep evolving when, frankly, it would be easier to just coast. If you're a surgeon, if you're a young surgeon, a leader, or anyone trying to stay sharp in a fast-moving world, take note. The future belongs to those who stay curious, stay grounded, and keep their vision clear. Duna, thank you so much for your time, for your insight, and the way you lead by example.
Thank you, Craig. It's truly my honor to work with you and to be on this podcast. I had so much fun, and love that we're able to get this conversation out there to our listeners. Thank you.
And to everyone listening, remember that this life is what you make of it. The future you is waiting patiently to meet the current you. Continue to work to find your tomorrow in today and keep the promises you make to yourself. Until we meet again, eyes wide, see everything. Goodbye.